Marcus Ball. So in today's quick educational video, I want to talk with you today about some things that might put a family on notice that their baby may have suffered a traumatic brain injury at birth. Now, these are no guarantees, but these in some instances can point to a baby possibly having problems during labor and delivery. The first one that I want to talk with you about today is if there has to be a resuscitation effort. In other words, the baby cannot breathe on their own and the doctors and the nurses, they have to help with resuscitation. Number two is if the baby is discolored in any type of way, if the baby is maybe a bluish in color or purplish in color. These things may, in some instances, be the result of a baby having oxygen problems during labor and delivery. So number two, if you've got a discoloration. Number three, if the NICU team is present and they're ready to take the baby for further care, if the NICU is there, that may in some instances be evidence of a baby suffering some type of traumatic brain injury. Now, in some instances, the NICU will already be present or the NICU will automatically be triggered if certain things happen during labor and delivery. And one of those could be, for some hospitals, is if mom has meconium. If meconium is present in the water, then that in some instances can show that the NICU team will be needed. Number four, finally, if there are low APGAR scores, when the baby is born at birth, if there are low APGAR scores, in some instances, you will see the APGAR scores. They will be given at the 1 minute mark, and then you have it at the 5 minute mark, and then finally, sometimes you'll have it the 9 or 10 minute mark. So if you've got low APGAR scores, that also may, in some instances, be, that may also suggest that your baby might have suffered a traumatic brain injury. Now, I know that I kind of talked about a lot in this video and I talked about it kind of fast, but I just wanted to help you understand these 4 areas of concern for a baby immediately following birth. If you are here today because your baby has suffered a traumatic brain injury at birth, maybe you have an HIE, a hypoxic ischemic encephalopathy diagnosis, or your baby has a subsequent CP or cerebral palsy diagnosis and you have questions. Maybe you're wondering, well, was this caused by something that the doctors or the hospitals did, or was it genetic? Was genetics the cause or development the cause? If you have all of that going on and you have questions for me, there's a telephone number on the screen. I invite you to go ahead and pick up the phone and call me. I talk with families like yours all the time about these issues, and I'll be happy to listen to your story. One more thing, I practice law in Maryland, and if you are not in Maryland, understand, and you contact me, understand that I have to use co-counsel, what we call local counsel. In other words, an attorney in your state to be able to help push the case forward. All right, that's going to be it for today's video. Talk with you next time.